When COVID-19 arrived 2 years ago, telemedicine emerged with the promise of better access to care through virtual delivery of clinical services and consultations. But according to a new study led by the University of Houston College of Medicine and published in the Journal of General Internal Medicine, the rapid implementation of telemedicine didn't bridge the gap as much as people had hoped. We found that racial and ethnic disparities persisted, said lead study author Omolola Adepoju, a clinical associate professor at the College of Medicine and director of research at the Humana Integrated Health Sciences Institute at This suggests that the promise of the positive impact of telemedicine on healthcare use and health outcomes could elude underserved populations. Adepoju partnered with Lone Star Circle of Care, a federally qualified health center, FQHC, that caters to indigent, uninsured and underinsured, mostly. The research team examined electronic medical records from 55 individual clinics in 6 different counties in Texas. Our main finding was African Americans were 35% less likely to use telemedicine compared to whites, Adepoju said. The people who really need to access their primary care providers might be cut out of telemedicine because they don't have the technology or might not know how to use it, Adepoju said. And only 66% of African American and 61% of Hispanic households have access to broadband internet compared to 79% of white households. The study also found that individuals younger than 18 years and older adults were less likely to have a telemedicine visit when compared to non-elderly adults, as were those covered under Medicaid coverage, or uninsured. Another factor that played a role was how far from someone lived from a clinic. We observed a dose response to geographic distance so that the further a patient lived, the higher the likelihood of telemedicine use, Adepoju said. The type of visit, whether for an acute or non-acute condition, was also associated with telemedicine use. The hope, according to Adepoju, is that minorities will be better educated and equipped to take advantage of it. But they'll need someone who can walk them through it to ensure their appointments are meaningful. Clinics will need a technology support system, she said. A staff that conducts pre-visit device and connectivity testing with patients can be instrumental to helping patients maximize telemedicine as an access to care option. Materials provided by University of Houston. Original written by Brian Lunn. Note: content may be edited for style and length. Omolola E. Adepoju, Minji Chai, Chinedum O. Ojinaka, Sharania Shetty, Tracy Angelochi. Racial and ethnic disparities in telemedicine usage persist during pandemic. Study finds minorities dealing with access to care issues. Science Daily. https://ift. TT, N8 UMXD1, accessed April 14, 2022. Thanks for watching. Please subscribe my channel for more videos.